So, for those of you who are new with us today, one of the things that we'll jump into here will be the first part of this training we record through. I talk through some of the core issues. And then from there, we get a little bit more interactive and we stop the recording and we can kind of field questions that might be prevalent. And I think this training, more than almost any other training that we've done, tends to be way more question oriented. So I'll give you my 10,000 foot view on these different roles. I think we'll put even some FOIA stuff in here so you can understand some other information sharing pieces as we go forward. So FERPA, like Marsha. It's one of the things that if you've been in higher ed for a hot minute or any other school setting, it's something that's come up. FERPA has been, it's almost like the hazing introduction, if you will, to higher education for new staff. People come in and it's like the specter of FERPA and HIPAA, are laying about. And there's not a great letter acronym for state confidentiality law, but it's absolutely part of the discussion that we should be paying attention to. So FERPA is a governing standard for educational records. The reason it's there is that there should be some privacy expectations, that we don't want professors just sharing term paper examples or scoring, for example, the student newspaper, or athletic coaches sharing who had a positive drug screen, or the registrar's office sharing all your personal identifiable email with all of your professors. So the idea behind FERPA, we can talk to each other in the campus setting if there's a legitimate educational interest that's being served. And that's fairly broad. So when we think about this, it really is, if there's a reason that that person has and needs access to some of this information and it's a legitimate educational interest, that's okay. This is where people who do FERPA programs, you're going to see all the codes and exemptions and laws. I think it's suffice to say, unless you're a lawyer and really need to get into the nitty gritty of it, it's that legitimate educational interest. Does this make sense in this space? So when we think about these educational records, we think about what these are. These are files directly related to that student experience and the work that they're doing. They're maintained by an educational agency, and that FERPA is governing your sharing of information. And in this place, we need to have some awareness of being cautious on sharing private information just, I think the legal term is willy-nilly, around campus. And under FERPA, there's a legitimate educational interest. So interestingly, this is going to cover a lot of our bit work, where folks might be reporting or sharing in some information with the behavioral intervention team. It would be the reason the bit or care or threat team could go to the admissions office and say, we would like to see the admissions essay for this student that we're working with. That would fall under that legitimate educational interest. The other big holes within FERPA are exemptions to FERPA. And FERPA really is a set of guidelines that I would describe is about exemptions, not requirements. So the exemptions are emergencies. So if there's something that's emergent, there might be risk to the person or other people. There is a big, I would describe it as a hole or a pathway through or around FERPA. So many schools in the past have tried unsuccessfully to use FERPA as a shield to say, we wish we could share this information with you. They really don't. But they say that, but FERPA prevents us. There's two things and two reasons I want you to call me immediately or send me an email or a text. One is if you're ever on a behavioral intervention team or doing this work and you say, we really want to share this information, but FERPA prevents us, you're probably wrong. And I would encourage you to email me so I can show you where you're wrong and that you have that freedom to be able to share that information more easily. The other thing I'll say, and it's unrelated to FERPA, but if your team or an individual says, this person's doing really badly, we're very concerned about them, it's only a matter of time until something bad happens, we just have to wait it out and then respond. That's also a bad thing to write down or to be in that place. So if you have someone that you think is circling the drain, is the medical term, I don't know how much I love that, or just driving their car towards the cliff of expulsion, we absolutely have things that we can be doing. And that's a great consult call to say, tell me the case. Here's some other things you could consider in terms of your documentation and your interventions that are going to put the school in a better. I don't want to throw all the shade at the registrar and financial aid, but they get a little shade on this because they come out at orientation saying, FERPA is important. We can't share this. We can't share that. And that's true to the parents more often than not. It's true around the community, but under legitimate educational interest. And then further under an emergency exemption, we can share information, especially amongst the college. The other place here is, and this one's a little tricky, if there is a dependency. So in essence, if the student is a dependent, they're declared on the taxes of their guardian or parent, is how that's defined. FERPA doesn't apply. This gets a little tricky, and I want to say this carefully. There's a couple places schools approach this issue. So don't go back to your administrator right now. And I'm saying this super clearly because people have done it. And they said, Brian said, FERPA doesn't apply. Well, that's technically true. The school, often schools and colleges, set an expectation and say, we are going to treat every student as if they're an independent until you prove otherwise. Or the converse is true. We are going to say in our admissions process, we're going to treat every student as a dependent until they're proved to be independent. So it's a bit of a whack-a-mole game. There's an interconnection to this. But yes, if you read the FERPA statute and the guidelines, you're going to see there's this dependency exemption. That's an important piece here. A couple things that I think it's good to know that FERPA does not cover. So FERPA is not covering these issues are sole possession notes. So these are these notes that we take, and we'll talk about this a little bit related to FOIA requests, but those side notes that we take. Law enforcement records are exempted from FERPA. Records that are exclusively for individuals in their capacity as an employee. So FERPA, within the definition, is education, right? So it doesn't cover employees. So that's an important distinction to know. We were talking with an SRO yesterday in Arizona, and we began, I always sense the slide into the FERPA conversation. I'm like, oh, here we go. The next 45 minutes are this. And we avoided the full slide, but understanding the justification for your information sharing. I'm going to say that again because it's a really powerful statement. Understanding the justification for why you can or cannot share information with someone is really, really important. There's a number of people who might say, well, FERPA says I can do this. Well, I'm like, well, are you an SRO, for example, a student resource officer, campus police officer? Are you considered under the student affairs unit? Are you a sworn officer? Are you a law enforcement unit? So we have to pay attention to where that. The other thing I mentioned in our training yesterday is BIT and CARE teams, when they say things like, well, we have a duty to warn this student that we've gotten a report that this other student is going to kill this student on campus. What I would say on this, and stick with me here because you're not going to like the first half, but what I would say is we don't have a duty to warn. The only people who have a duty to warn are going to be people in mandated reporting capacities. We have a duty to report, and that's to a police or a social service agency. And we have a duty to warn with medical providers. So duty to warn is related to licensure. So there's probably a couple people on your team who might have a duty to warn with their patients if they share, I'm going to kill someone, but that falls under TARASOF. And TARASOF is defined state by state. We can talk about this in the Q&A a little bit, but one of the TARASOF considerations to invoke duty to warn for a clinical staff person is each state might have a should, an ought, or a must. And some states say you should warn, some say you must, and others say you ought to warn. So understanding, again, these statutes before you're in these situations are important. Doctor-patient privilege, clinical notes, notes of therapists, of counselors, and let's again be careful here. Licensed clinicians, part one, right? Hired by the university to provide medical treatment or counseling treatment. So what isn't covered here, and this is a really big distinction, so I'm kind of broadening this out for you, is non-clinical counselors, people who they may be licensed, they're just not hired to do medical treatment, or they might not be licensed, they're just having the term counselor. They fall under FERPA, and their records fall under FERPA, rather than the higher standard of state confidentiality law. And I can clarify that as we go, but that's just the overarching piece right here from the beginning. Also excluded are alumni records. All right, HIPAA. So for HIPAA, first of all, spelled with 2 A's, that's important, and it's a pet peeve of mine as well. So it's the Health Insurance Portability and Accountability Act. HIPAA is, one way to think about it, is very similar to FERPA restrictions in so much as it sets out standards for medical professionals to talk to each other, but it does suggest that they have to be licensed and they have to be what's called a HIPAA entity. And this is very confusing on a number of college campuses because what they find themselves doing is they might have a health service. So they say, well, we fall under HIPAA. And the question I often say is like, do you? Like, are you a HIPAA entity? And there's a flow chart. I will find this for you, and Bethany can link it. Maybe we can find it now, Bethany. It's a flow chart to determine if you're a HIPAA entity. And I think you can find that somewhere on the net and attach it in the chat. But for HIPAA entities, it requires that you do medical billing and that you transmit that billing electronically. So essentially what HIPAA was founded to do was to address medical providers sharing privileged medical information through electronic means without permission of the patients. So that's why many of us sign HIPAA releases. The bit of wisdom I'll drop on you now, and this is from like a lot of time talking about this 20 years in the higher ed field, is that some colleges say in their health services or counseling services, they're going to follow HIPAA, right? That they are going to, their standard is HIPAA that they're following, and they're going to follow HIPAA under the counseling and the health center. And that's fine. I do think it's a larger semantic discussion to help them understand that they might not be legally a HIPAA entity, but they're going to follow HIPAA out of an abundance of caution. In the counseling space, we do this as well. We might have a group that says, well, I'm a counseling center on a college campus. I'm going to follow the IASC standards, the International Association of Counseling Services. They have a licensure standard or certification standard. They might not be certified by IASC. However, they're going to follow that standard. And that's fine. I think that's actually a good thing. But understanding the difference between being obligated to follow a standard and just they're going to do it, those are different things. So one of the other spaces that I found myself in with HIPAA and FERPA, and there's that great document Bethany dropped in the chat a few moments ago related to, because you can imagine this is a question people get all the time about HIPAA and FERPA and like, how do they intersect? So the idea here is that FERPA, again, covers the educational records. A lot of the bit work is really covered by FERPA. HIPAA tends to be more related to the counseling, but even more commonly, like the medical information on things. But HIPAA, like FERPA, has an emergency exemption as well. So if the person's a danger to themselves or others or to the community, there's an exemption where we can actually talk a little more freely in that HIPAA space as well. State confidentiality law is yet another higher standard. So I really should make a graphic that shows FERPA is one standard that's important. It's more broad. It covers these things. A standard that supersedes, that's more important than, so that replaces FERPA, is if it's medical records, that might be HIPAA, but it's also state confidentiality law. So each state, for their licensed providers, and it is state defined here, has requirements in terms of confidentiality, what they can share and not share. It's also referred to as privilege. In those situations, this is where it's a little tricky. So if I'm running a counseling center, I might have, you can see here on the graphic. So if I'm running a medical center, I might have doctors, PAs, nurse practitioners, I might have lab techs, I might have office managers. And we have to decide in terms of licensure standards, who's following under HIPAA, is the entire organization falling under that, and what state confidentiality laws are there restricting doctors, medical doctors, nurses, maybe you have a social worker embedded, an LICSW. So you might have a medical clinic that has like 5 different standards of confidentiality law that they're following. And then add on to that, another little piece is that each of these medical practitioners has an ethical code. This came up big time in Tennessee, where, and sorry, Tennessee, to call you out on this, but Tennessee, for the medical providers in counseling, they gave those medical providers an exemption to treating, they basically said for a licensed professional counselor, someone who's licensed as a clinician to provide mental health care, you're in a position where you can refuse to provide care to someone who is gay or lesbian. This caused lots of problems and remains causing problems because the state law says this is a right that you have to be licensed in the state. To practice in Tennessee, you have to go through the American Counseling Association or the LICSW, the Social Worker Association, all of which their ethical codes say you cannot refuse to treat certain people. So as you get into the nitty-gritty of this, it's where consultants probably do some of their best work very quickly. And I know I'm belaying this point right now, but very quickly going to the heart of your campus, what's going on there. And at least starting, I think it's always starting with this place of here's the standard and let's talk about the practical application. Before I add FOIA to the mix, and it's just kind of a last point, let me answer these questions and yeah, it's rough in Tennessee like that. You look at this and it's like you have 2 conflicting standards and they're recursive. Depending on how you define it, it's like you can do this, but this part says to even practice, you need to follow this, which says you can't do that. So it's just a mess. So a couple of answers to these questions, and I'll make a couple points here that are useful. Let me go back to this one. What we can and cannot release to the parent of a dual enrollment, a 16 and 17-year-old. I have a great answer for that. It's one of my favorite answers to give. So for dual enrollment programs, and I would actually say this is like an ethical approach to almost everything to avoid lawsuits and ethical problems and treatment. We got to define things beforehand. It's so critical to do that. We had a program at Western Kentucky. It was the Gatton Academy dual enrollment program on our campus, and they had had decided how they were going to handle these issues before they ran into the problem. And I know that sounds so super basic, but it's so important to not write policy after the problem comes up. That's the first thing I'd say. They're going to fall as a minor. And it's going to be state law defined that under 18, that you're going to need to have parents' involvement, oftentimes permission for treatment in those spaces. The gray area of this is that me treating, when I'm a, say, a licensed professional counselor, treating an 8-year-old, parental involvement is very different than when I'm treating a 17-and-a-half-year-old. So there's a bit of a diminishing return, if I could say, in terms of what we might share with parents as the person gets older. The problem is, legally, by definition, we need to be aware of this situation with the parents. So I think with a program like dual enrollment, and we were blessed at Western with this, we had a program where it was actually had their internal counseling center. They hired a counselor to be embedded within the program. So they handle this internally. But if we ever found ourselves, and we did occasionally at the counseling clinic, being asked to service or offer services to a minor, acknowledging the parental piece and the guardian piece of this was important. And if there's going to be exceptions to that, I think that's written into a handout or policy or your informed consent that clearly defines beforehand, these are some areas where we don't share with parents of, we have a 16 or 17-year-old, here are some examples of what we might share, here's where we might share very little. The whole point of this, I think, what you're getting is we got to talk about this before the problems occur and have an agreed upon space. What you don't want to have happen is a parent coming to you after the fact saying they've been talking to this counselor for 6 weeks about this issue and no one told me that they're suicidal and I'm going to sue the school. So that would really be helpful in a policy space, and we can help you develop these if you'd like. I've certainly written them before, but making sure that you're very clear about what are the exemptions to this, where we will contact parents and at what threshold. So it's almost more important to explain out how you're approaching this beforehand than to have a certain way of approaching it, if that makes some sense. Really good question. The other thing I'll say, and this one's always upsetting for people, so I'll say it to you with an ounce of caring. In terms of FERPA, if a faculty member, for example, shares a report with the BIT or care team, that's a FERPA action, right? So they're sharing information that becomes part of our Maxient record, or however we're keeping the database on the team. We've already said, and we should say in our policy and procedure manuals, that these records are managed under FERPA. And as we're getting that information, the team does the case, they do an assessment, they do the thing a good BIT team does. They gather data, they form an assessment, they build interventions. So as they've finished that process, the question always comes up, what happens when the faculty calls and asks for an update? And let me say this really clearly, and it's a scary thing to say, the team can share an update with the faculty member. Why is that? Well, it's under FERPA. So it's under legitimate educational interest, or it might be covered under the emergency exemption, especially if the thing the faculty member was sharing was a threat or a risk. So the phrase I use here a lot is this: while we can, should we? Right? So there should be some cautionary steps that you take just in terms of how much we might share back with certain faculty. An example might be if the faculty member is prone to hanging pictures in the break room or around campus of students they don't like, prone to hysterical reactions or missharing information, that would be something that I would be much more hesitant to share with that other person. Here's a good, clear example of a FERPA violation. An athletic director is talking to a press conference and they say, one of our players has tested positive for marijuana. His name's Brian Van Brunt. And I just want to say I'll be not playing for 2 weeks. This is sharing of medical information, of protected information, educational information, potentially with. So there's some clear examples where FERPA does actually become at play, but very rarely in the BIT space, or if there's a space where we're doing this kind of protective work. FOIA is, first of all, for FOIA, there's two different things you have to think about. There's federal requests for information because most colleges or universities are covered, Department of Education, they're receiving funds, that's going on. That then leads to the public information request, the request to request this information. So this might be information related to like energy usage, aggregate data in the conduct space, salaries of folks. That's the federal piece. The state piece is defined state by state and looks very similar, that there's times where oftentimes it's the student who's working with the student newspaper, they're trying to uncover some public information. Essentially, the students, especially at state institutions, have the right to make these requests. Anyone does. Some things can be redacted, like names and identifying information, but the idea of calling up, looking at some of the aggregate data can be important. Why is this good for you to know? Well, sometimes we see, and I've had cases like these where there's been a FOIA request for the energy usages broken down by different departments. So this would be an opportunity for a student to make a case, say if the police were patrolling too much. What's their gasoline usage year to year? Where are their patrol routes? So there could be some of the requests that could fall into this. The fossil fuel usage at an entire school be part of an environmental program's attack on the school's overuse of fossil fuels. These would be things that FOIA requests are related to. The big one, though, emails. So the idea, especially at state schools and with state requests, that the request for email communication within this network could be requested. And this gets to why it's so important to use a system like Maxient, which I think because the records are in Maxient, because they're in this system, Simplicity, Advocate, Pave, whatever you're using, because they're in that system really holds FERPA protected information. So you just have this good, consistent argument to say if there's a note in Maxient, it's not discoverable under FOIA. It's really something much more related to FERPA. The problem here is if we're talking about bit and care cases informally through Microsoft Teams, through chats, through emails, through Slack, Monday.com, we're basically creating a nightmare if those records are then requested at a different point. So one of the things you hear from us frequently, and you've heard from me for years, even when I was with NBITA, is just the importance of keeping your bit and care records in one database and really avoiding those email communications. The other place FOIA requests come up is just around things that you want to kind of brainstorm about, a number of FOIA requests. And this was one that came up as well in terms of COVID response and how the university has been dealing with that, actually getting access to some of those records. So it's the old saw. If you write it down, just be realizing what that might be like reading it out. Bethany, I'm going to just pause here with the recording.